there, Kristen. Probably your year. Yeah, 819. You know, many people enjoy fun footwear during the summer months, but they may be unaware that there are actually a higher than expected number of injuries and infections because of what people put on their feet. Here with the different risks that can come with summer footwear, how you can simply avoid them, podiatrist Katrine Mitchell. Good to have you. Thanks so much for being here. Appreciate it. Albuquerque Health Partners is where you're from. So tell me about, Doctor, about what exactly the types of injuries are that you receive.
We see a lot of plantar fasciitis, which is arch pain, and this is caused a lot of times from shoes that don't have much arch support, flip-flops, maybe a minimalist running shoe that somebody's taking their outdoor sports activities, you know, starting a sports program outside because it's summertime, more walking. And so some of the shoes just don't have an adequate support system, and we get what we call a plantar fasciitis, which is inflammation or pain along the arch.
Now, I've experienced that. That is not fun, and part of it was because of no support in a shoe. So how many, I mean, it's obviously flip-flops are probably a culprit, common one. People walk around barefoot too. Yes,
yes, and that's also a risk for even foreign bodies stepping on something, infections, especially for our diabetic population, and that can be quite risky for them as well. We also see tendonitis in summertime, Achilles tendon ruptures, generalized tendonitis from sports programs, and even fractures, stress fractures. I've seen those with flip-flops as well, and ankle sprains.
Any other type of shoes we should be concerned about?
Well, also the minimalist running shoes. We really don't suggest those for most people. I mean, some people could probably get away with that, but most patients, when you're running, the stress to your feet increases by about 3 times to 4 times your body weight. Even with walking, it's about 1.5 time increase. So you can imagine that there's a higher chance for fractures and what we call stress fractures. You really want a good support system with running.
Now, those minimalist running shoes you're talking about are the ones with the toes, right?
Yes.
I mean, a lot of popular brands out there right now that look just like that. So a lot of people are at home thinking, man, I don't want to give up my flip-flops.
Right.
Do you have to give them up altogether?
You do not. There's some new brands now that have a built-in arch support. And so that's what we suggest. But when you're doing exercise or a running program, walking, you really want a good athletic shoe for that. And there's some out there that have excellent support systems. And you can even, some patients even need an orthotic or arch support. And that's where we recommend seeing your podiatrist for an evaluation.
I was going to say, what other kinds of things you can do to sort of prevent yourself from getting an injury? Are there more?
So adequate shoe gear, support system, also a good stretching program before and after your exercise. And that's where we see a lot of these Achilles tendon ruptures, especially, as well as a tendonitis from a lack of a good stretching program.
What about for kids? All right, this is a time when a lot of kids are going out on the playground. They need to watch for this too? Or are you in kind of a different state when you're younger?
Well, I think the foot is a little bit more forgiving, but in some kids that have a flat arch, yes, absolutely, orthotics can help.
Absolutely. And those that have a high arch really do need to watch for support. There's a lot of shoes out there that don't, even ones that go over your foot, right, and maybe tie.
Right.
You have to watch for that, right?
Absolutely,
inside?
Absolutely, yes.
And you can help with that.
Yes, we can, and we have 4 specialists with ABQ Health Partners that are specifically foot and ankle specialists, and we're all board certified, and we have 3 different locations. And so ABQ Health Partners also has 40 different specialists out there that can help you with a variety of medical treatment.
It's good. It's good to know. Dr. Mitchell, thank you so much for being here. And of course, we're going to link to that website too through KRQE.com so you can get more information from ABQ Health Partners. We'll be right back. Don't go anywhere. Thank you.